My name is Ankit Darvi. Originally, I am from Madhya Pradesh and residing presently in Indore. In September 2021, I started to feel some pain in my left leg while doing gym, and started getting some alternative medicines like ayurveda and all. But it came to my mind that I should visit a doctor, allopathy doctor. So I went to a doctor. He suggested MRI, and I went for the MRI of the knee because the pain was in the knee, not in the hip. So when the MRI was done, it was the result was that it was not related to the knees but to the hip.
Okay.
The impression was that. So I got the MRI of the hips done, and it came to be AVN, avascular necrosis of. It was bilateral. Of
Okay. Both the hips.
Of both the hips.
और grade क्या था?
It was stage 2 in both the hips.
Okay.
Both the hips.
Okay.
Then I started looking for options because at that time hip replacement was not in my mind.
Okay.
Because I had some issues at that point of time, and over a period of time I started looking for options, and then I came across Core Decompression with stem cell therapy, and I got the
Surgery
procedure done, and for 1.5 months I was on bed.
After the surgery, you were on bed for
After
1.5
the surgery, I was on bed for
Okay.
1.5 months, 45 days, and I was walking with the help of a walker, but not that much, just inside the room only.
Okay.
And then when the walker was removed, for some 10-20 days I walked normally, but then the pain started worsening,
Okay.
the limping started, and over a period of time it got even worse.
Okay.
And by the end of September, the condition was such that I was not even able to ride the two-wheeler,
Okay.
and even driving a four-wheeler was very difficult because you have to apply the clutch. So the pain was worse.
Okay. And how much were you able to walk after by September? Your surgery was done in January, I believe. Yeah. Core
January,
decompression.
February, the
Okay.
surgery was done. There were 2 procedures, and I was able to walk only for 50 meters. Maybe sometimes I might have walked for 100 meters, but that was very difficult.
Okay. And it was very painful for you.
It was very painful. I was not even able to sit on the chair. Lying on the bed itself was difficult.
Okay.
Then I started looking for other options. Then options which will help me in a better way to make the life which used to be.
Okay. Restore your life.
Restore the life which I had earlier.
Yeah.
So I came across Dr. Vikas Jain in Indore because when I started looking for options, I came across his videos on YouTube, and when I saw the videos, I came to know that he is doing some procedure with which you can do most of the activities. In fact, all the activities that normally a person does.
Okay. After hip replacement, you can do all that.
Yes, after replacement. So I went to Dr. Vikas Jain, consulted Dr. Vikas Jain in Indore, and he told me and explained me about the direct anterior approach to hip replacement, and he explained that with that approach you can do all the activities generally a person does, and explained all the things, answered all my questions, and with all satisfaction we decided that we will go for the surgery, and the surgery was performed in the month of November. It's almost 50 days the surgery was done, and today I'm walking like anything, walking 5-6 kilometers a day in a single stretch.
Okay.
In a single stretch, and there is no limp, and I can't feel pain anymore.
So you're not feeling the pain you used to have before?
I can't even remember that.
Okay, that's good.
That at some point of time I even had that pain. I'm doing completely fine. And I still remember that I was made to walk after the surgery. I mean, 8 hours after the surgery, I was made to walk, and within 3-4 days, I even left the walker.
You're able to leave the walker within 3-4 days.
Within 3-4 days.
This is the advantage with anterior hip replacement.
Exactly.
Because the muscles are damaged less and all, so the recovery is much quicker. Okay. And what would you suggest anyone who's having a hip AVN problem or is planning for a hip replacement?
Anyone who is having such problems, I mean related to the hip or AVN, should visit Dr. Vikas Jain in Indore, because in my opinion he is the best in the business.
Okay, and are you happy with the technique? Like,
yes, very happy with the technique because when I was doing research on various approaches to the hip replacement, I came across posterior and there were other approaches as well. But the benefit of direct anterior is that you can do most of the activities because there are a lot of precautions that come
you need with
other
posterior.
approaches.
Yeah, and apart from that, there are two more things: that there is a minimal risk of dislocation,
Yes,
almost negligible, and the other thing is you can get a completely equal limb length after anterior. So that is one of the reasons that ki limp or lurch nahi hota. You're not having any limp right now, right? You are very satisfied with that also.
Yes.
Okay, so if you're walking around, do people think you had a hip replacement? Ki they just consider it's completely normal. Like,
no one is able to figure out that, sir. Even I'm walking better than other people because my friends get tired when we are walking together, and I don't get tired.
you're comfortable with
yes,
it.
yes.
Okay, chaliye. Thanks a lot. And you're happy with the team also, Dr. Vikas Jain?
Sure. I highly recommend Dr. Vikas Jain and team.
Okay, thank you.